Hey, good to see you guys.
Too.
It's been a little while.
It has.
How are things going?
Actually, really well.
For me
Yeah.
especially.
Yeah, great. I just want to talk to you guys a little bit about your experience with us, just to kind of give an idea of what it's like to get treatment for this, for your arthritis at our center.
Okay.
So how'd you find out about us and what we're doing?
I found out about from a support group that I volunteer at the Council on Aging here in St. Clair County. And somebody had mentioned that people were amazed at the results that they were getting, and kind of piqued my interest, and I thought I'd give it a shot.
Yeah, this is such a great community because a lot of our patients are coming in from word of mouth, from hearing from other people. I know it's a smaller city, and so people know each other. They're in groups, they go to church together, and the information gets around. So it's one of the great things about working in Port Huron.
Right.
So you heard about it, and you gave us a call.
I gave you a call because I've had a knee issue for the past year. And I did not want to have surgery, so I've tried other means and nothing had worked. So I thought, well, why not give it a shot and see if it worked?
Yeah, I mean, arthritis is one of those things. It's just like, it's not so bad where you're like crying out in pain. It's kind of a nagging thing that you go to the doctor for, and they give you this prescription or this physical therapy consult, and a lot of the times not much works, or not much works well.
Right.
Yeah.
Right.
And so, we talked. You came to see us, and I reviewed your history and your imaging, and we thought you were a good candidate. You have degenerative joint disease, or osteoarthritis, and we found with our experience and with the medical literature coming out from Germany that low-dose radiation therapy was a good treatment option for you. We found it to be effective in about 60 to 70% of the patients that we've treated, and this is in alignment with what we see in the scientific literature. So after we talked, we decided to go ahead and give it a try and treat your knee.
Yeah.
And we typically do 6 treatments every other day.
Right.
And so we had to schedule a CT simulation first. And that's basically a scan for us to plan the treatment. How did that go for you?
It was fine. It's fine. Interesting. I've never had a CAT scan done before, so it was interesting to see how it's done.
Yeah.
That was fine.
Mostly laying there?
Yep.
No pain, no pokes?
No pokes.
Yeah. So we don't need IV contrast or oral contrast or anything like this for the CT scan. And we don't always have to do CT scans. It depends on the body part we treat. So then we rush in for treatment soon after the plan was done.
Right.
And the first day, how'd it go?
I think I was a little nervous, not knowing what I was going to feel. I didn't feel a thing. The staff was lovely. They always made me feel at ease.
Yeah.
And it was over within a few minutes.
Yeah, we really have a great staff here and a good team. They're really kind, caring people.
They're definitely nice.
Yeah. And so, you don't feel a thing. That's what patients tell me. Occasionally, some patients get a flare, but most of our patients don't feel anything at all, which is your experience, right?
I had a little bit of a flare the second visit, but it lasted maybe 24 hours. With some relief, it was gone.
Okay. And then after you finished your treatment, did you notice anything right away, or not right away?
Probably within 4 visits, I started noticing it was a little bit better. I'm a runner, and so that was my test to see if I could run or do some jumping jacks. That was the other thing, and I could do it without feeling pain, so I was pretty excited about that. It continually got better after we were completed as well. So.
Yeah, it tends to work over time. Some people get a benefit midway through treatment, and others, it could be a month or 2 after the treatment is done. And so that's why we schedule follow-ups a few weeks after, and then a few months after to kind of see where you are. And you said you started running more again?
Yeah, back to running 2 to 3 times a week.
Okay.
Yeah.
And then you told this news to your mom.
I actually called her right away after we had talked. And I was surprised she jumped on the phone and called, made an appointment. So.
Yeah, and then Betty called us, and then we saw her.
You can only feel so much pain so long.
Yeah, you were really uncomfortable when we saw you.
My hand used to throb, the knuckles, and my foot. I couldn't even walk hardly.
Yeah.
It got to the point where I could get groceries and then barely get home.
So these are like normal activities of daily life that were becoming really challenging.
Right. And I've always loved to walk and do things, but it was getting harder and harder.
Yeah, I mean, my father, who's since passed, had arthritis of his hip, and he would have been a good candidate for this treatment, and I wish we'd known about this years
Yeah.
ago.
Right.
Because, I think it would have helped him with his discomfort and his stiffness.
Definitely helped me, for sure.
So, you were showing me a video on your phone.
Yeah.
What was that?
We were in Albuquerque, New Mexico with our grandsons, and they decided to mountain walk me, and I'm going, oh yeah, walk up a mountain. I had a stick, walking stick. I never would have made it with the altitude. We were up 10,100 feet.
And you're out hiking.
Walked up that, yes. And it was only, a mile and a half up that we
That
walked.
one, but then you walked
Then
3
the
to
other
4
one
miles.
was 3 miles to a waterfall.
My goodness.
And that was 2 days in a row.
back-to-back days.
Right.
And you said before that wasn't going to happen.
No, never. And I hardly could make the grocery store. My foot would hurt. I'd have to take my shoe off, and people would have looked at me kind of funny.
Yeah.
But I made it both ways.
That's amazing. I mean, I want people to
Oh,
enjoy their lives, especially.
I'm so much better. And at first, I didn't know if it was going to work or not. When I talked to you last, I thought, I don't know. I haven't had any swelling in it since, and doesn't burn. And I'm wearing shoes all the time now, which was really hard before. My husband was going to cut the center out of the top of it because that's where it hurt the most. And I said, I'm not walking around with a shoe with a hole out.
Oh my gosh. Oh my
But
gosh.
so far, I'm wonderful. Thank you. That's all I can say is,
We
it's a different life.
we love to share this treatment. It does require some faith on your part.
Oh.
It's a new treatment in the United States for sure, and a lot of the times new is scary.
Oh, yes.
And I think we've gotten to the point we've treated enough patients where it doesn't feel like experimental anymore. And we're seeing the results.
The part I liked was no pain.
Yeah, no side effects,
And
right?
quick. I mean, we weren't here hours. It was 5 minutes for the hand and I think 10 or 15 for the foot.
Yeah, I tell
that was
patients
it.
most of the time it takes longer to drive here than to do the
Yeah.
treatment.
Right.
I was very happy with it. Still am.
Gosh. Well, guys, thanks for coming by today. I
Oh.
really appreciate it. I love hearing
you.
these stories because it really makes it worthwhile that we brought this to the community.
Well, we're very
Absolutely.
I'm very thankful for you and my daughter. I have to give her credit.
Yeah.
Well, see you at the next follow-up.
Okay. Thank you.